Hi. We usually post videos about the procedures that we do on patients. The purpose of it is to be educational and to show the type of procedures that we do at our centers. Today we're going to be different. We might even be strange because today the patient and the physician are the same person. That is, um, we're gonna be doing the physician is going to be doing a procedure on himself, which is me. I know this sounds way too strange and might be even weird, but I have my reasons for doing so. Several reasons. One, really to I need it because I do have the procedure is going to be a PRP or platelet rich plasma into the meniscus, the medial meniscus. I do have a meniscus tear and I need it. I need treatment. Number two, I wanted to show my patients and whoever is watching that the procedure is very simple, safe, and almost painless doing it. Number three, I wanted to feel what patients feel really. I wanted to feel what patients feel with my hands and not necessarily through a different physician's hands. And most importantly, again, I needed the treatment and I trust that PRP is the right treatment for my condition. The story goes back several years. As a kid, I had an injury playing a sport, and I had a meniscus tear, medial meniscus tear. About 20 years ago, I underwent surgery, very primitively, honestly. Even at the time, they dropped me off of the stretcher. Since then, I suffered from chronic knee pain. I managed to live through it intermittently, gotten aggravated with any sports. And about a year ago, I decided to do an MRI, which showed I had a complex medial meniscus tear. I did a PRP on myself back then, which it worked. It worked very well. I even repeated the MRI 3 to 4 months later, and it showed some improvement in the tear itself. And it was fine until I started training for a marathon, and I ran about 270 kilometers in 1 month on sand without tennis shoes. Of course, the wrong thing to do, and therefore I re-injured myself. I couldn't tolerate the pain because it started to progress, preventing me even from going up and down steps without pain. I repeated the MRI and the tear is still there, complex, and therefore we decided to repeat the procedure. So the procedure is a PRP, platelet rich plasma. Essentially, we took 60 cc blood from me. We isolated the platelets and concentrated them by 10 times. Then under the ultrasound guidance, we performed the procedure. As you see the procedure, after I numbed and I did a nerve block because I did it on my medial meniscus and I also did it on my foot since I developed plantar fasciitis from walking on the sand. After the nerve block, the procedure was very tolerable. In the medial meniscus, I did not feel any pain performing the procedure. The foot, there was some discomfort. I really did not even need to take any pain medication except once before I went to sleep, just to make sure that I'm not gonna wake up with pain. The night was uncomfortable to say the most, but was not painful. I was hesitant to turn left and right to avoid pain, but otherwise it was not painful. The next day I went back to my normal routine. Yes, I was limping for about 2 to 3 days, and within about 4 to 5 days I was able to bend my knee and walk normally. And hopefully I'm going to start a physical therapy program a week after the procedure. Again, the reason I'm posting this is really not to be strange or to post a strange video, is just to prove a point. PRP is a phenomenal option for pain, for injuries, especially meniscus tears or any even ACL or any type of joint injury or pain. PRP is a very simple procedure. that I can perform on myself without any problems. And also, it can give you phenomenal results. One last thing, please don't try this at home, and don't even try it at a doctor's office. I only did this so I can demonstrate how easy the procedure is. I have done this for years, so I have the experience and the level of comfort to even stick myself with a needle. But please do not try this at home or suggest it to anybody, and be safe. Thank you for watching, and continue to follow. Thank you.